Pregnancy can be a really weird time. Lots of things are going on physiologically. You feel different in a lot of ways. I think people sometimes wonder, am I depressed? I'm Dr. Nichelle Haynes,
I'm Dr. Kristen Lassiter.
and we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
So today we want to answer the question of what does depression or what can depression look like during pregnancy so that if you're feeling weird, that you might be able to figure it out.
Yeah. You know, a lot of times people will come into my office and they're like, well, I'm feeling this way, or I'm crying a lot, or I'm really irritable, but I think that's just the hormones. But I want to
It's so cute.
say that pregnancy hormones, yes, they will make you feel a little bit different, but they're not going to completely change your mood like that.
Well, did you ever just like randomly cry at a commercial?
But it's not like you're going to be doing that all the time.
Right. No, it happens occasionally.
Yeah,
I guess it would
it's
just be
like-
the pattern. Yeah.
Yeah, but I think one distinction to make between pregnancy hormones and like these occasional times of being a little bit more emotional versus like mental illness is a mental illness. It's this change in your mood or anxiety that is going to be there most days.
Consistently, right?
Yeah.
It's not just like it happens when you see a thing, it's consistently would be happening.
Yeah.
Yeah. So what symptoms could you notice that are related to depression, right? Changes in, well, just feeling down, sad. Some people describe it as like feeling blue or just like not excited about anything. I just don't feel like myself.
Don't really enjoy anything.
Yeah.
And something that can be very specific and kind of unique to pregnancy is that people often feel irritable instead of feeling sad and crying all the time. It's just like this irritability that comes out.
Yeah, definitely. Okay, so that would be, one component. And then, of course, sleep can be, it's just so difficult in pregnancy. It's hard to know whether it's related to you're just uncomfortable and you have to get up and pee and you can't turn over and you can't sleep the way you would normally
Back
sleep
pain,
and you're hurting and all of those
totally.
things. Yes. But so that one's really hard to sort of tease out.
It is hard to tease out, but something that I think can be helpful is noticing, am I having trouble falling asleep just because my brain won't shut off?
That's true. Yeah.
Am I waking up because my brain's just not getting good rest and won't go into deep sleep mode? Or is it physical, like, oh, it feels so bad? Because you can usually tell.
Yeah. Sometimes it's both.
Sometimes it's both.
Yeah, true. I think another one that comes up especially strongly in pregnancy is this guilt, right? Like, oh, I'm not doing enough, or I shouldn't be eating the Fruit Loops or whatever the thing is that kind of that is your pregnancy gravy.
Yeah. So if it's noticing feeling excessively guilty, like this isn't normally how I am, or even feeling a lot of worthlessness and like just feeling down on yourself and talking to yourself negatively, that can be a sign of depression and pregnancy.
And then energy, which is another hard one because early pregnancy, especially, most people are really tired because it's a lot of physiologic metabolic demands on your body. So that time is kind of just like, maybe, maybe not. But especially in the second trimester, if you're really struggling with energy, in either way, right? Like if you're having no energy, that could be problematic. But if it also feels like an internal like restlessness can also be some kind of representation. I think that usually comes out as like irritability or anxiety. Yeah.
Or if you're just not motivated to do the things that you usually do, like not motivated to brush your teeth, or it feels really hard to take care of yourself, or it feels really hard to go to work or take care of the house, like things that for you usually aren't an issue. If those things start feeling really hard because there's no motivation there to do it, then that's another sign.
Yeah, similarly, interest. If you're just like, I'm just not interested in going to play pickleball or whatever the thing is that you like doing, right? If you're not interested in doing that thing, that may be a sign of depression. What else? Concentration can be hard. In pregnancy, without thinking of depression, but if it's more in the context of everything else.
Right. Like you're just having a really hard time more. And again, it's kind of like with concentration related to pregnancy, it's usually kind of these moments of just noticing, oh, I can't remember what I was doing, or I can't remember what that word was, or kind of just more of this forgetfulness. And it's a little annoying, but it's not going to affect your ability to do your work or get things done. Whereas concentration related to depression is usually much more impactful, and that you can't sit down to get work done anymore or read or
right. It's a sort of more profound, impactful difference. Yeah. Of course. If
appetite.
Oh yeah. Appetite. That's hard too, because once you get later in pregnancy, there's just not as much space.
Yeah.
Right, for food. So you don't feel
right. Yeah. So I feel like we keep saying this, like it's hard because so many of these symptoms are also symptoms of pregnancy. And I think that's why it's so important to talk with somebody who has specialized training in perinatal mental health, if that's available to you, because it's hard to tell about yourself, right? But appetite, yeah, that can be a tricky one.
Early pregnancy, late pregnancy, middle, it does not matter. And I think this is why we make this video, right? Because it's nuanced, it's complicated, and there's lots of different things that we would need to know as clinicians to be able to assess whether this is a thing that happens in pregnancy or this is something else that we might need to look at addressing. So hopefully this information is helpful for you to have more information about whether you want to have that discussion with someone.
And then a big red flag that you're experiencing depression in pregnancy is having thoughts of death. So maybe that looks like, oh, my family would be better off without me, or they don't really need me here. Like if I just disappeared, that wouldn't be so bad. Or it could be all the way extreme of thinking of ways to end your life. And I think this brings up a lot of guilt for people and a lot of shame. But depression really messes with your thoughts. It tells you lies. You start thinking things that aren't normal for you to think, and that is not you. That's the depression.
So if that is the truth for you, that you're somewhere along that spectrum, you would definitely want to talk to someone about how you're feeling and help yourself feel better, because it's totally possible. And I think another thing is, like, depression will tell you that it's not possible to feel better, and that is absolutely not true. We have really solid treatments, and there are definitely ways to help you feel better. So do not let depression trick you into thinking that you're going to feel like that forever.
Yeah. And don't tough it out either. Don't think, oh, I can get through this, or if it's just this next thing. We have a whole video on why you shouldn't wait it out to get treatment in pregnancy if you're noticing depression.
Right. Thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.